now we have heard three gentlemen speaking about the problem and the surgeon's perspective to this problem, and then a possible solution in the form of registries. Now, let's open the discussion and hit ourselves up for the charity run. So, do we have any questions from the floor first? Please, Tom, go ahead.
Hi, Tom Slusser from Utrecht. My question is to the MedTech representative. What is currently mandatory for post-market surveillance within the new MDR? And what would you like it to be? Because I can imagine that in the registries there will be a lot of off-label use of certain implants that actually you would prefer to only have the data of intended use.
Yeah, so I think that that's coming back on the, we have great opportunity with the use of registry for post-market clinical follow-up, definitively. But again, I think that the challenge is the definition of the registry, the data that are collected, and the definition around everything that you mentioned on the device, the PROM, and the assessment on product specific. So there is some intent with the EU Commission to update MDCG document, but I think that we have huge opportunity as a whole, I would say industry, but as well healthcare professional, to provide much more definition around registry to make it accepted by the EU Commission. So I see it as opportunities. At the time being, we are not using it as such. It's not accepted.
Yeah,
Marinus, you have a response to this?
I've always been a big fan of registries and outcome measurements, but that's because I want to know what the outcomes of my intervention are. However, Tom, your question is extremely relevant, because if in the registry you don't register what the intended use was, then you're starting with nothing and you'll get nothing. The other thing is, all the other registries in the world are extremely simple. A hip implant, and maybe there are 10 hip implants. There used to be 75 in the Netherlands, now there's only about 10. We've just heard there are 200,000 spinal implants, and that's not covering everything. And as soon as a pedicle screw changes in profile, you've got another 1,000 coming in. And if you have a registry, is the burden going to be on you and me to put the data in when the intended use isn't clear? And the outcome is the outcome complications and safety, because it's mostly a safety regulation, or does it matter what the PROM is after 2 years? And PROMs and patient-reported outcomes, or it's questionable whether they are even relevant. So by building a spine registry without knowing what the purpose of the spine registry is, we're going to create an enormous administrative burden, and I think we're not going to get the answers that the EU MDR needs. So I'm actually very skeptical of combining those two, because of the completely different question that the registry traditionally tries to answer compared to an implant quality assessment tool. And I think those are very different purposes, and especially in spine, because it's, as I mentioned, if we're doing a L4-5 degenerative slip, even for that there are 10 different procedures, 20 maybe. Whereas if you've got this degenerative hip or a degenerative knee, it's either you get an arthroplasty or you don't. So I think that in spine registries we'll probably not be able to answer the EU MDR needs.
And you don't see any opportunity to make it happen with
not in the traditional way that we see a registry. So the fact that we do post-market surveillance, I think, is very important, but that's different to how a registry is classically designed.
At time. But if we are providing more definition on the patient outcome.
But do you need patient-reported outcome measures to get your EU MDR documentation to the notified body? Do you need 2-year osmostry scores? If you have a fusion device, the question is, did you get a fusion?
So, gentlemen, obviously this causes argumentations in both directions. Yeah, but perhaps we really have the question here. Emin, can we really measure the outcome of an implant or safety of an implant with ODI or another outcome measure PROMS? Is it feasible? Are we going to the right direction, or should we do something else? What do you think as a registered professional?
Yeah, thank you for the question. Let me answer it in a way which is a little bit specific. We have been discussing with the spinal registries how we should position ourselves towards the medtech industry. And many of the registries ask the same question: why should we? Because there are obviously other interests in place for the registries to have the clinical outcomes, to be doing quality assurance, to be certified, to collect epidemiological data, to understand the practice variation, etc. And there is also an medtech interest in place. And we, I think, have a very good opportunity to have a win-win constellation, an ecosystem like with all key stakeholders, and try to basically include all the interests in the same concept. Otherwise, we would end up having different databases, different approaches, and different solutions. I would say none of the registries is perfect and will ever be perfect. They are just created for a specific purpose. So we need to further develop our registries to be fit for purpose. And I can say that in spine tango we have the question about the therapeutic goal. So we know whether the product is used for example, pain reduction or spinal stabilization as a primary goal, or the deformity correction. So to some extent we can monitor the indication. But I would, to answer your question more specifically, I would not say that we need all information collected in the registry just to answer the need of medtech.
Yeah. But any other questions from the floor?
Can I ask Wolf? Wolf, what do you think we need to capture to fulfill the legal requirements of the EU MDR for an implant?
It's the clinical evaluation and the clinical evidence. For me, it's quite murky when I read the regulations.
Exactly. And do the notified bodies actually understand this?
No, I mean, they can go to an expert panel maybe, but I don't see it. Listen, I've read and reread the regulation, and I'm struggling with it.
So one of the ideas that I had is that maybe we should start educating not just our members, but also educating the notified bodies.
Right.
Would that help?
Sure.
100%.
Because maybe the notified bodies, they don't care about outcome. They just want to know if it's safe. I don't know whether that's true, but I'd like to hear from the notified bodies. And I understand from MedTech is that all the notified bodies have their own way of doing this.
It's almost the catch-22, because if you talk about intended purpose, now including the benefit of the device.
That's different.
Right, but it loops back into what kind of evidence do you need to show the benefit? And you're going to have a hell of a QMS system to try to capture this post.
They're trying to assess safety and performance.
Yes, but safety I can understand. Say we have a 6-week or 12-month complication rate. Total hips we just saw, we need 8 years, we need 10 years. But safety is one thing, but performance is something completely different. Because performance, if it's safe, but you still get a non-union, but it's safe, or it's safe and you get a fusion, but the patient's in horrible pain. Right. There are so many variables that come. So safety I can understand, but performance I can't understand.
And performance equals benefit if you read the regulations that way. So it used to be you describe a device and you say this is how it's going to work. And now you're going to have to ask yourself, is it working the way you described it? And for me, that's the big paradigm approach by the MDR. It's flipped it completely around to your point. So I can't answer your question.
May I just add, I completely agree with this difficult situation, but just one comment. I think this is the role of the specialist to develop concepts here, evaluation concepts and metrics. Because if we won't do that, nobody else will do that. But potentially we will get much more regulation. So we have to work on this.
I agree. That's what I meant by the health advocate. Yes, we have to stand up, but I think we should be keep it really simple.
Yes.
I mean, maybe it is just dead or alive. We're always, because we're scientists and researchers, and we're looking at quality of our healthcare services, but that's not what the EU MDR was intended for. So we have to change our mindset as well, because if we start adding 10 proms to a core data set, and then the notified bodies start asking for each of those 10 proms for every single spinal surgery, we've killed ourselves.
Yes.
So we've got to be really simple.
Yes, I agree.
Michel, one more comment.
If I may, I fully agree that we need to engage with notified body and with regulator, because they don't have the
Knowledge.
a great understanding,
Yes.
I would say. And that's really an opportunity that we have to expose them and to propose.
Yeah, wonderful. Thank you very much. This concludes this quite well. I would say this is a nice attempt to make the market and the implants safer, but obviously we have lots of challenges. But luckily we still have, let's say, 4 years time to adapt it and make it better for the implant industry, for us surgeons, and so that perhaps the registries play also one role in this in a way or another. So I hope you got a bit more informed about the MDR, the facets of MDR and the problems of MDR, but especially for the fact that MDR is in a way or another going to affect us all. And with that, I'm going to conclude this session. I am very thankful for the presentators. Thank you that you were here. And let's then stop the session and go and prepare ourselves for the charity run. So have a nice evening, everybody. Thank you.
Thank you.